burnout is characterized by mental and physical exhaustion and tends to happen in work conditions, in chronically stressful work conditions where there's a lack of resources. And so workers feel like there's a great demand that has to be met, but there aren't enough resources within the workplace to accomplish that. And burnout can happen in any sector. It doesn't have to be in a sector where you're working to provide services to individuals. It can happen in any type of workplace where those conditions are present. And the thing about burnout is that the symptoms of burnout exist within the workplace, but people experiencing burnout are still able to feel satisfaction and happiness outside of the workplace. So they're still able to have good family relationships, have enjoyment on the weekends, hanging out with friends, but it's really about the workplace that is the source of stress. Compassion fatigue is something different. So compassion fatigue happens to workers who are in a caregiving role, who are providing help often to people who are traumatized. In compassion fatigue, what happens is that the worker, feeling kind of overwhelmed by perhaps the narratives that are being heard or the type of work, starts to feel like it's hard to get anything done, feeling a little bit helpless in the situation. And the symptoms might be kind of overextending oneself and providing too much assistance, becoming kind of over-involved. But it could also be withdrawal, so kind of withdrawing from clients and maybe blaming clients for the situation that they're in. Vicarious trauma probably has the most kind of severe symptoms. So in vicarious trauma, what happens is that a worker who is exposed to a lot of traumatic material, again, often in a caregiving role, providing services to clients who have a history of trauma, who have narratives of past difficulties. In this situation, the worker might start to feel different cognitively, spiritually, on all sort of levels of their life, physically also. It's vicarious trauma doesn't only affect people in the workplace, it can actually bleed out into other parts of the person's life. So they might start to feel like their relationships at home with their family and friends have been negatively affected. They might start to feel depressed, not being able to concentrate, having memory problems, even outside of the workplace. They might also start to think differently about themselves, about other people, and about the world in general. They might start to feel like the world is not a safe place or that people aren't trusting. So it actually changes the person's perspective entirely, not only about themselves, but also about other people and also about the world in general. So in terms of trying to prevent these things, there are things that individuals can do to engage in self-care. There's something called the ABC approach. So A is awareness, so having an awareness of one's own limitations, one's own expectations, one person's own needs. Having balance, so the B is for balance, so having a balance between work and play and rest, so knowing when to sort of leave the office, knowing when to engage in other activities. And C is connection, so having a connection to oneself and to other people, so always thinking back to what is the meaning of the work, and also having sort of a purpose, a sense of purpose in the work and also in one's personal life. On an individual level, there's lots of things people can do to take care of themselves. So they can make sure to exercise and participate in social activities, build social connections with people. They can try to eat right, practice good nutrition, try to sleep, engage in spiritual lives, whether that's going to church or mosque or doing other kind of spiritual activities that give people a sense of purpose and meaning. So there's lots of things that people can do to identify. There's lots of things that people can identify for themselves about what works for them. On an organizational level, organizations can prevent burnout and vicarious trauma and compassion fatigue among their workers. One, by becoming knowledgeable about what these things are and being mindful for the signs and symptoms so that they can recognize if their workers are struggling and put an intervention in place. Other things that workplaces can do is make sure that workers feel valued and respected. So this hugely prevents vicarious trauma and burnout. Strategies can also be put in place in a workplace, so making sure that workers, for example, are able to engage in peer support, that there can be case conferences, debriefing sessions, where workers can connect with one another and talk about difficult cases or talk about struggles that they're having, and reach out to one another in that way. So those are some of the things that organizations can do also to prevent self-care, along with also providing workers with constant professional development, constant education and training, so that workers feel more skilled in the workplace and also are able to recognize when they need to step back and take care of themselves.